Hi guys, Dr. Pascal here with Spinal Health Distributors. Today we're going to be talking about the lumbar Denneroll. So the lumbar Denneroll was designed for patients that have a loss of the lumbar curve and a flattened sacral base angle. Okay, so that's determined obviously on X-ray. Now we have three sizes of the lumbar Denneroll. We have the small or pediatric unit, the medium, and the large. The small is the only unit that's designed to go at L4, L5, so in the lower or distal lumbar spine. The medium unit is for patients that have loss of the lumbar curve with roughly 25 millimeters, so about an inch of posterior thoracic translation, and the peak will be L3, L4 or above, so mid to upper lumbar spine. And the large unit is going to be for either very flexible, larger patients or patients that have significant posterior thoracic translation, so 2 inches or more of that posterior thoracic shifting. So let's go ahead and start by demonstrating how to use the small lumbar Denneroll. So the small lumbar Denneroll, we're going to try and target the lower lumbar spine, L4, L5. So we're going to have the tapered end towards the head. And what we do is we teach our patients to do this at home on the floor. Now, so I'm going to have my patient start by laying back on her back. And what we want our patient to do is to lift their hips to insert the Denneroll. So we ask the patient to bend their knees, lift up their hips, and we slide the Denneroll, or they will slide the Denneroll into position. Now first we're going to see an example here of the Denneroll being positioned a little bit too high, and we can see that her buttocks are still lifted off the table. So if the patient is really rigid, this might happen at first, but sometimes too it can indicate that the peak of the Denneroll might be too low. So we'll have her lift her hips and we'll just slide the Denneroll up just a touch, and now she should be able to get her hips and her tailbone touching the table. If the patient is very rigid or they're experiencing some low back discomfort at first, we can have them keep their knees bent for a more comfortable position. Ideally though, as they progress and they get used to using this unit, we want them to straighten their legs because it will traction the lumbar spine more and create more ligamentous creep. Now, whenever we use a lumbar Denneroll, we always want to pay attention to what's happening in the cervical curve as well. So every time we use a lumbar Denneroll, we want to make sure that we're not flattening that cervical curve. So if the patient has a good existing cervical curve, we can have them roll up a towel or use a pool noodle, something that is in the shape of a cylinder, and we would just put that under the cervical spine to protect or support the cervical lordosis. If we took x-rays of the patient and we know that they need more cervical curve, we can use a cervical Denneroll at the exact same time. So a lot of my patients, I will put them on both a cervical and lumbar Denneroll at the same time so that we can work on both curves simultaneously. To take out the lumbar Denneroll, we do the same thing. We have the patient bend their knees, and then we have them lift the hips, and then we teach them how to slide the Denneroll out. We always have our patient rest on the floor for a minute or so before standing up, just to rest and make sure that they're not dizzy as they come up. So that was the pediatric or the small unit. Go ahead and sit up again. We'll go through the medium unit. So the medium Denneroll is going to be used for patients that have a little bit of posterior translation. Remember, we said 25 millimeters, so about an inch of that posterior shifting with loss of the lumbar curve. So now we're going to want to use a little bit of a thoracic support, because if not, the patient's going to extend too far backwards over the Denneroll. So now, for the demonstration purposes, we'll have her lay back on the Denneroll. Just hold on one sec, we'll slide that down. Good. So she's going to lay back on the Denneroll. So now the peak is at about L3. And we're having her slowly come down until the shoulders touch that support block. Now again, we would do the same thing. We would put either a rolled up towel or a cervical Denneroll, depending on what's happening with that cervical curve, to protect that cervical curve. So go ahead and bend your knees. We'll take out the Denneroll. And then lastly, we're going to teach you how to use the large lumbar Denneroll. So the large lumbar Denneroll is obviously for taller patients or patients that are quite flexible, or if we have a shorter patient that has a significant posterior shift, 50 millimeters or more, we can see if this would be appropriate for them. So go ahead and sit up for me, Adrian. And you're going to need a larger thoracic support block as well. So this here is 70 millimeters of thoracic support. The tail of the Denneroll, or the tapered end, is going to be towards the sacrum. The patient's going to lay back. The peak now for our patient here is going to be touching L1 to about T12. And we can see how it's creating a significant anterior shift of her rib cage, putting a lot of lumbar curve. And then the good thing with this thoracic support block is the patient's head is hanging over. So in this case, we may not need to use a cervical Denneroll. We can simply let their head hang back over top of that thoracic support block. So we have the patient use the lumbar Denneroll at home daily. If the patient is sore after using the Denneroll, we have them put some ice on the affected area for 15 minutes. Contraindications for the lumbar Denneroll include fractures, canal stenosis, instabilities, and worsening of the patient's symptoms. If any of those things occur, we have the patient stop and then check back in with us. If ever the practitioner is uncertain as to whether or not the Denneroll is appropriate for the patient or where to put the peak, we suggest that you take a stress x-ray of the patient while lying on the lumbar Denneroll. Every single unit has a user guide. So we want the patient to build up to 15 minutes of traction daily. Now the user guide teaches the patient how to build up to 15 minutes every single day. If you have any questions or you'd like more information, please feel free to give us a call.